Hello friends, continuing with our series of benign endobronchial polypoid lesions. As you all know, endobronchial lesions can be benign or malignant. Malignant lesions include primary lung cancers as well as metastasis from other areas. Most common benign lesion is pulmonary hematoma, which we have already discussed. Other lesions include leiomyoma, lipoma, papilloma, pleomorphic adenoma, granular cell tumor, endobronchial hemangioma, fibromas, neurogenic tumors, inflammatory myofibroblastic tumors, as well as non-neoplastic lesions like amyloidoma, fibroepithelial polyps, and bronchial tuberculosis. This week's case was Tracheobronchopathia osteochondroplastica. These are described as rare benign lesions, but we are seeing more and more cases thanks to sensitive radiological techniques as well as wider availability of bronchoscopy facilities. These lesions are characterized by numerous sessile, cartilaginous or bony submucosal nodules distributed throughout the anterolateral walls, projecting into the laryngotracheobronchial lumina. They usually present as incidental findings during bronchoscopy or autopsy. It was first described by Rokitansky macroscopically and Wilks on microscopic examination. There have been several theories put forward regarding its etiopathogenesis. Most recent and accepted is metaplastic changes involving elastic tissue, followed by transformation to cartilage and calcium deposition. Reported incidence is around 2 to 7 cases per 1,000 people, usually presents between 25 to 85 years of age with no gender predominance. Radiologically, on chest X-ray, it may have normal appearance or may show tracheal calcification or stenosis. It may also show changes of associated other diseases like tubercular sequelae, alveolar consolidation, bronchiectasis, or pulmonary nodules. On CT scan, you may find submucosal nodules, submucosal calcification, or isolated nodule, and in severe cases, tracheal stenosis. Endoscopically, disease has been described in 3 stages. In stage 1, whitish lesions are seen throughout the tracheal mucosa with mucosal hyperemia and edema. In stage 2, there are diffuse cartilaginous nodules protruding into the lumen, giving copplestone appearance. And in severe stage 3 disease, deformed and stenotic airways that cause airflow obstruction. This is bronchoscopic picture of our case. Here you can see multiple polypoid, submucosal, pearly white and whitish nodules as well as whitish patches. Histologically, there are 2 main abnormalities: abnormal cartilage and bone proliferation in submucosa and squamous metaplasia of surface normal columnar epithelium. There may be associated inflammation and necrosis, calcium deposition, adipocyte fragments, and hematopoietic bone marrow tissue also can be seen. This is the picture of our case. Here you can see bone formation with adipose tissue and some inflammation around. This is high power view. Here you can see surface squamous metaplasia, which is metaplastic squamous epithelium with metaplastic bone. There are no definite medical treatment for tracheobronchopathia osteochondroplastica, as it is difficult to remove the nodules. Treatment will depend on the symptoms, and usually it is symptomatic unless patient has recurrent obstructive symptoms or severe airway obstruction. In that case, laser ablation, cryotherapy, surgical resection or radiotherapy can be used. These are the differences I have used in this presentation. Thank you very much. Have a good day.